Are migraine headaches and headaches in general ruining your life? Do you feel like you don't have energy for family and friends because your head hurts so darn much? Do you find yourself getting depressed and frustrated that all of the doctors and all of the tests don't have any answers for you regarding your headaches? Do you feel like you've done all the treatment in terms of chiropractic and physical therapy and massage and nothing's helped? And are you tired of taking the addicting pain medications? Well, I was there approximately 15 years ago. I had severe headaches. They started in the back of my head on the right side. They radiated up over the top of my head and settled behind my right eye, and it felt like there was an ice pick going through the right side of my head at about the level of the temple. They were severe and unrelenting. I had had many blows to my head as a child as well as a young adult doing sports, and I think I basically caused some of my own problems. I was fortunate though, because when I was having these headaches, I was also going to school to become a Canadian trained osteopath. So I was up in Canada and one of my instructors treated me, and she treated the cranial system. So the cranial system, again, composed of all of these different bones that have to work together. So despite all of the treatment that I had in terms of physical therapy, chiropractic, and massage, nobody had been able to get rid of my headaches. They had all focused on the neck, but this is the cranial system that nobody had been focusing on previously. So again, we have all of these different bones moving together and a lot of different facial bones here, and she actually found many restrictions with respect to how the bones of my face moved. When she treated those, and it was approximately 30 minutes of treatment, it took away my headaches. It changed the upper neck mobility on the right side completely, like nobody had been able to do previously. To this day, I've not had a return of headaches, and because of that, I've dedicated my professional career to trying to solve patients' issues with headaches. So again, the frustrating thing for patients is there really isn't a test to reveal a cranial problem. Cranial problems don't show up on X-ray or MRI or CAT scan. So the only way to know if you have a cranial problem is to see somebody that's very, very qualified in terms of assessing the mobility of the different bones of the head. Myself being a Canadian trained osteopath as well as a physical therapist, I've spent the better part of 30 years studying the mobility of the head. So if you come in to see us, what you will see is we will be performing a thorough evaluation of the head or cranium as well as the neck. We don't forget that the head sits on the neck, so we have to evaluate the vertebra in terms of how all of those structures are working as well as the muscles that connect the head to the spine. But the more important thing oftentimes that we do is we evaluate how these different bones are moving. Evaluation involves the therapist placing his or her hands on different areas and testing the mobility of the different structures in terms of the sutures between the bones, which are again the functional joints. So we can see in terms of motion testing, and it's very gentle, the sutures or the joints where there are restrictions in terms of normal movement. Treatment is very, very gentle. It's very, very easy for the patient. It involves gentle pressures in terms of the therapist placing his or her hands upon the head in different manners and holding there and trying to separate very, very minimally the sutures to restore mobility to the blocked or restricted sutures. When we restore mobility to the sutures or these joints, we eliminate tension as well as compression on the nerves, arteries, and veins that may be causing your pain. So really most headache and migraine headache patients have a history of blows to the head. They can be large, they can be small. So I really want you to think back in terms of your history and look at, have you had blows to the head in terms of car accidents, sports blows to the head, even without a helmet or with a helmet, as well as sometimes even somebody hitting you in the head. That can happen sometimes as well. Dental, I will call it trauma, is sometimes an issue in terms of the dentist utilizing large forces and pressures in order to accomplish what they need to do with the teeth, and they inadvertently cause compression of some of these structures, typically through the facial area and kind of behind the eye. So you really need to look at the history in terms of blows to your head to see if you may have a cranial issue. I want you to think about it, and if you do, and this sounds like you in terms of your symptoms and you're tired of the pain, give us a call at 719-694-8342 at Manual Edge Physiotherapy, and you can speak to a therapist about how we might help you. If you have any questions, we look forward to talking with you. Thank you. Bye-bye.